I'm Yinging. I'm Associate Professor of Health Economics at Institute for Health and Aging at the University of California at San Francisco. I'm also affiliated faculty member of the Philip R. Lee Institute for Health Policy Studies at the UCSF. My research focuses on the economic analysis of tobacco use and exposure and economic evaluation of tobacco control policies. Tobacco use has adverse health effects. As an economist, I'm interested in the economic impact of active tobacco use and passive tobacco exposure. For example, my research is to answer the questions such as how much healthcare costs are due to tobacco use and exposure, how much extra resources the schools need to use to handle the tobacco use epidemic among adolescents. The accurate estimate of the economic burden of tobacco use or exposure could help policymakers to understand how much cost could be saved if the rates of the tobacco use and exposure decreased by 1%. I also evaluate the tobacco control policies, such as the federal and state tobacco tax policies. Although we found these policies decrease the tobacco use and exposure rates, alarming tobacco use and exposure disparities based on demographic, socioeconomic, and geographic differences remain. For decades, the tobacco industry has unequally targeted different communities, which has made these communities disproportionately suffer from higher than average tobacco use and exposure rates and higher rates of tobacco-related disease and death. Therefore, another important part of my research is to evaluate the impacts of tobacco control policies on the minorities, such as socioeconomic disadvantaged groups and African Americans. In the future, I will continue to work on economic analysis of the tobacco use disparities and evaluation of the impacts of the tobacco control policies on health equity.